The broadcast is now starting. All attendees are in listen-only mode.
Hello, and welcome to HDSA's Lunch and Learn webinar series. Today we're going to hear from Jason Gromley, who will talk about HIPAA, the Health Insurance Portability and Accountability Act. Before I turn it over to Jason, I'm going to go over how to ask a question, as well as how to access this webinar after broadcast. But first, a brief disclaimer. All the information that is provided in our webinars is for informational use only. HDSA encourages all attendees to consult legal counsel on who can apply law to the facts of your case. So we're going to answer all questions after the presentation is concluded. However, you can send a question at any time. To send a question, go to the control panel that appears on the right-hand side of your screen, type in your question, and hit send. This webinar will be available for viewing approximately 1 week after broadcast. In order to view the webinar, you go to www.hdsa.org/ll. You can also find all of our webinars in the Living with HD section of the website. Now I'm so pleased to turn it over to Jason Gromley. Jason Gromley is a Director of Government Relations at Strategic Healthcare, which is HDSA's lobbying firm in Washington, D.C. Jason works in a team to make sure that the voice of HD families is heard on Capitol Hill. Jason holds a Juris Doctorate from the Earl Mack School of Law at Drexel University, as well as a bachelor's degree from the Indiana University of Pennsylvania in political science, with minors in pre-law and economics. Jason is licensed to practice law in Pennsylvania and New Jersey. And now I'm thrilled to turn it over to Jason.
Excellent. Thanks, Jean. Sorry, clicking there. All right. So today I'm actually joined by one of my legal fellows here at Strategic Healthcare, Chelsea Serio, who has done a lot of extensive research and work on HIPAA in both her professional practice as well as here at Strategic Healthcare. She helped me put this presentation together, so I'm very excited to welcome Chelsea to the presentation as well. Chelsea, would you like to introduce yourself?
My name is Chelsea Serio. I'm an attorney in New York, Massachusetts, and Tennessee. I'm going to American University, Washington College of Law, and receiving my Master's of Laws in Health Law and Policy, and I'm very excited to be helping out today.
Excellent. So let's get started here. I also have a disclosure and then a disclaimer. So the disclosure, I have not had any personal financial relationships with any commercial interests that I need to disclose or list relevant to this presentation during the past 12 months. And disclaimer, I'm just going to re-emphasize what Jane said before. HDSA strongly recommends that if you have any questions about a HIPAA violation that you believe may have happened or a complaint, please contact the Department of Health and Human Services, the Office for Civil Rights, for further guidance. Any information we're providing here is only. No information contained herein constitutes any legal. The examples included were extracted from laws, regulations, and examples used by the Department of Health and Human Services, the Department of Labor, and they should not be relied on as legal advice. And any users of this information are urged to seek legal counsel who can apply the current law to the unique facts of your case. So now that we've gotten all of that out of the way, how did HIPAA become law? So it was first introduced in the United States Senate by Senator Edward Kennedy, a Democrat from Massachusetts, and it was co-introduced by Senator Nancy Castlebaum, a Republican from Kansas. The co-sponsors of the legislation were Paul Wellstone, who was a Democrat from Minnesota, a very liberal member of the Senate, and Senator Richard Lugar, a Republican of Indiana, a pretty moderate to conservative Republican. So this was a very bipartisan bill from the very beginning. The final version passed in the Senate by unanimous consent on April 23, 1996. What unanimous consent means is all of the senators agreed, we don't even need to vote, nobody had any objections, so it passed in the Senate. It then went to the House, where it was a little bit of a different story. It was first introduced in the House in 1996 after it passed in the Senate, and it contained some additional language that wasn't included in the Senate bill, the administrative simplification provisions, and it passed there 421 to 2. So again, overwhelming bipartisan support. 10 members didn't vote, and those 2 members that voted against it were Representative Pete Stark from California and Representative Williams from Montana. Both of them were Democrats, and both of them voted against the bill because they didn't feel it went far enough to protect patient interests. The bill was finally signed into law by President Bill Clinton on August 21st, 1996. So what is HIPAA? HIPAA stands for the Health Insurance Portability and Accountability Act of 1996, and it provides the ability to transfer and continue health insurance coverage for millions of American workers and their families when you're changing or losing your job. That was the ultimate goal of HIPAA. That was the thing that it was first introduced to take care of. It's not what we really think of HIPAA as now. We think of it as patient protection. It was also intended to reduce healthcare fraud and abuse, and it sets some industry-wide standards for healthcare information on electronic billing. And then, of course, what we think of as HIPAA is requiring the protection of confidential handling of all of your health information. So HIPAA is setting a basic standard for health insurance in the U.S. It's setting what we like to call the floor. So the federal law is the floor, but individual states may offer more stringent protections of your healthcare information. You can contact your state insurance commissioner's office to learn more about the insurance laws in the state where you live. And we've included a link here so that you could click that after it's up on the HDSA website to give you more information on your particular state. So HIPAA has two parts. And in those two parts, you have Title I and you have Title II. Title I is health insurance reform. This is, again, the part that we don't really think about when we think about HIPAA today, but it's protecting health insurance coverage for workers and their families when they're changing or losing their jobs. Title II is the administrative simplification. You'll remember this was added in the House of Representatives. It establishes national standards for electronic healthcare transactions, and it addresses the security and privacy of your health information. So Title I, healthcare access, portability, and renewability. So we're going to cover a couple things in this, and I want to be very clear. Since the adoption of the Affordable Care Act, there are going to be some changes at the beginning of 2014. So we're going to do this presentation with some caveats throughout, letting you know what will and will not be in effect after January 1st, 2014 as we go through. Second, what does Title I do or prevent? So there are a bunch of things we're going to cover here. The ability to enroll in group and individual plans, prohibiting discrimination using your genetic information, pre-existing conditions, job changes, credible coverage, and how this interplays with GINA, the Genetic Information Non-Discrimination Act. So here's that caveat I was talking about. Beginning on January 1st, 2014, the Affordable Care Act, sometimes known as Obamacare, prohibits insurers in the individual and group markets, with the exception of grandfathered individual plans, from imposing a pre-existing condition exclusion. So what a grandfathered individual plan is, just to take a step back, a grandfathered individual plan is a plan where an individual or a group had health insurance prior to the date that they had set aside in the law. And I believe that it's March 23rd of 2010. For children under the age of 19, this protection was phased in already. It began on September 23rd, 2010. So starting September 23rd, 2010, children under the age of 19 had protection from a pre-existing condition exclusion. For anyone 19 or older, it's being phased in on January 1st, 2014. The ACA is also going to require insurance companies to offer insurance coverage to any applicant, regardless of any pre-existing condition or of their gender. They may not charge higher premiums to those individuals. Also, HIPAA protections are still going to be in effect, and GINA is still going to be in effect after January 1st, 2014. All of these things are just going to build upon each other to lead us to a much more stringent protection for individuals and their healthcare information. So moving on, interplay with the ACA. So in the ACA, a major provision is the establishment of a guaranteed issue. That just means that health insurance carriers in either the group or individual market have to provide coverage for everyone who requested after January 1st, 2014. The law prohibits issuers from denying people based on pre-existing conditions, which is a huge step forward for any individual that had a pre-existing condition, but also for the HD community in particular. The ACA, oh, that was strange. Sorry about that. The ACA is further providing additional protections for patients with genetic diseases by establishing that certain health insurance issuers may only vary premiums based on a few specified factors, and these are laid out in the law. So age, geographic area, whether an individual uses tobacco, thus they cannot adjust the premium based on your medical condition. So what does Title I do or prevent? So back to HIPAA, back to the law in general, what is the Title I doing? It's providing additional opportunities for you to enroll in a group health plan if you lose your other coverage or experience certain life events. And it's guaranteeing that certain individuals will have access to and can renew your individual health insurance policies. That's big, broad, generally what it does. It's also prohibiting discrimination against employees and their dependent family members based on any health factors they might have. That includes any prior medical conditions that somebody might have, your previous claims experience that you might have had in your health insurance policy, and especially your genetic information. Under HIPAA, you and your family members can't be denied eligibility or benefits based on health factors when enrolling in a health plan. In addition, you may not be charged more than similarly situated individuals based on any health factors which you may have. Now, again, this is when the Affordable Care Act is going to go into effect on January 1st, 2014. So what it's saying is they can't pick you out of a group plan and say, you have, this particular pre-existing condition, so we're going to charge you more, or you have this genetic condition, so we're going to charge you more. That was in place under HIPAA previously, and it's going to be strengthened under the Affordable Care Act. Individual insurance plans, where someone moves from a group plan into an individual plan, that individual cannot be denied health coverage or be given a pre-existing condition exclusion. That's if you're moving from a group plan into an individual plan. So again, I want to stress that this slide is not going to be accurate after January 1st, 2014 due to the implementation of the Affordable Care Act. However, it will be important to know until January 1st, 2014. So it's going to, HIPAA limits the ability of a new employer to exclude coverage for any pre-existing condition. So a plan is allowed to only look back 6 months for a condition that was present before the start of coverage in a group health plan. The law, the specific text is, pre-existing condition exclusion can be imposed only on a condition only if medical advice, diagnosis, care, or treatment was recommended or received during the 6 months prior to your enrollment date in the plan. HIPAA is prohibiting plans from applying a pre-existing condition exclusion to pregnancy, genetic information, and certain children as well. So Title I continued, pre-existing conditions, job changes, and your general protections. So let's ask a couple questions. Can a plan deny benefits for chronic illness or injuries like carpal tunnel syndrome, Huntington's disease, heart disease, and cancer using a pre-existing condition exclusion? I'm going to give you a little bit of a lawyer answer here. It depends, and it depends on whether you receive medical advice, care, diagnosis, or treatment within the 6 months prior to enrolling in that new employer plan. If you did, you can be subject to a pre-existing condition exclusion. So in a typical scenario here, so Joe just changed jobs. 7 months ago, he received his last treatment for carpal tunnel syndrome. Can his new employer's plan apply a pre-existing condition exclusion? No, because it was outside of that 6-month look-back window. Again, this is not going to apply after January 1st, 2014. I can't stress that one enough. So, another example, so Denise now has had arthritis for many years before she came into her current job. So there are 2 scenarios. If she did not have medical advice, diagnosis, care, or treatment in that 6-month window before she enrolled in the health plan, then the arthritis cannot be subject to a pre-existing condition exclusion. Or if she did receive any medical advice in that 6 months, then the plan may impose a pre-existing condition exclusion for that condition, only that condition, which in this case was arthritis. So limitations, it only applies to health insurance. If you have a pre-existing condition that is going to be excluded from your plan coverage, there's a limit to the pre-existing exclusion period that could be applied by the insurer. 12 months is the guideline, 18 months if you enroll in your plan late. Some people with a history of prior health coverage are going to be able to reduce that exclusion period even further using credible coverage, which we'll talk about in just a second. So just remember, a pre-existing condition exclusion relates only to benefits for your or your family members, if you're in a family plan, their pre-existing condition. So if you enroll, you will receive coverage for everything else the plan offers under their benefit package, except for whatever they denied based on that pre-existing condition. So credible coverage. Credible coverage is, there's a definition here. I'm going to break it down to the bottom line. It's pretty simple. If you had at least a full year of health coverage at your previous job, or you had it as an individual plan and you enrolled in your new health plan without a break of 63 days or more, that 63 days is very important. Your new health plan cannot subject you to a pre-existing condition exclusion. So it's very important. They cannot subject you to that exclusion if you didn't have a break of more than 63 days. So let's give you an example here. So Greg decided to change jobs for a better promotion. He found a new job, which he started 4 weeks after resigning from his previous position. His new job offered a similar health insurance package, and he enrolled in a family plan. Greg is in good health, but his wife has type 2 diabetes, and one of his children has asthma. Greg has worked for his previous company for 2 years, and he had no health insurance coverage. I don't know why that keeps popping up. I apologize again. So Greg had worked for his previous company for 2 years, and he had no health insurance coverage for 4 weeks, which is less than the 63 days that we had talked about before. In spite of Greg's pre-existing health conditions in his family, his plan was not able to impose a pre-existing condition exclusion period because he didn't have a break of more than 63 days. So now let's talk about GINA for a second. Again, this is the Genetic Information Non-Discrimination Act of 2008. It's expanding the HIPAA non-discrimination provisions that we've discussed. It's prohibiting the use of your genetic information to adjust group premiums or contributions, the collection of genetic information, and requests for individuals to undergo genetic testing. So all of those things are prohibited. I want to direct you, we've done, Strategic Healthcare in the past has done a whole presentation on GINA, and we have a pretty comprehensive review of GINA on the website. You can access that at www.hdsa.gina. All right, so now that we've covered Title I, I just want to take a quick second to recap. Title I, again, is the purpose of the HIPAA presentation was put into effect in the House and the Senate. Originally, Senator Kennedy and Castlebaum, they wanted to have these protections for individuals when they moved from one job to another. That was the original purpose of HIPAA as legislation. After it got to the House, Title II, the preventing healthcare fraud and abuse, and the administrative sections were added. So HIPAA Title II. We're going to talk about the background on Title II, the two parts of Title II, the privacy rule and the security rule. And then we're going to go pretty in-depth into the privacy rule and cover the security rule pretty broadly, as it doesn't apply to a lot of situations that you might encounter. So the background on HIPAA Title II. HIPAA required the U.S. Department of Health and Human Services to develop regulations that were going to protect your privacy and security when it came to your important health information. To fulfill this requirement, HHS wrote the HIPAA Privacy Rule and the HIPAA Security Rule. So the HIPAA Privacy Rule is going to regulate how certain healthcare entities are going to use and disclose your health information, and the Security Rule is going to deal with your electronic protected health information. I'm going to refer to these as EPHI as we go throughout. So the Privacy Rule. We're going to talk about what is protected health information, individually identifiable information, coverable entities, the permitted uses of your information, and we're going to talk about some myths versus facts that come up pretty frequently in these conversations. So, background on HIPAA privacy. So the rule formalizes many of the policies and procedures that were used to safeguard patient information and maintain that physician-patient confidentiality. The privacy rule is addressing the use, disclosure of individuals' protected health information by covered entities, and we're going to define what that means in just a second. It's also defining the standards for individuals' privacy rights to understand and control how your health information is going to be used. So what is protected health information? It is any information that is held or transferred by a covered entity or its business associate in any form or media, which is legalese way of saying it's anything that we say that it is. And we in that circumstance is the Department of Health and Human Services. So individually identifiable health information. It's a subset of any health information that identifies the individual or can reasonably be used to identify the information, or the individual. So including any information that relates to individuals' past, present, or future physical or mental health condition, the administration, I apologize again, the administration of health care to the individual, or the past, present, or future payment for the administration of health care to the individual. All of those things are covered under individually identifiable health information. So who is covered by the HIPAA privacy rule? And when we say who, of course you are, because it's your identifiable information, but what entities, what healthcare providers are going to be covered by HIPAA? So the privacy rule applies to the covered entities. Those are health plans, healthcare clearinghouses, and healthcare providers who transmit health information in electronic form or in connection with certain transactions. Health plans. So individuals and group health plans that provide or pay the cost of medical care. Health plans include health, dental, vision, prescription drug plans, so a plan that only covers your prescriptions, HMOs, Medicare, Medicaid, long-term care insurers, and employer-sponsored group health plans. It also covers any government or church-sponsored health plans. This is a pretty comprehensive list of anyone who would be offering health insurance coverage to an individual. Number two, healthcare clearinghouses. So the definition of a healthcare clearinghouse is an entity that standardizes health information. They include billing services, repricing companies, community health management information systems, value-added networks. You're probably never going to have to deal with this entity directly. They're mainly used by insurance companies and healthcare providers to standardize billing practices, to file claims, things like that. So you wouldn't be dealing with them directly, but your insurer or your physician may be dealing with them. These people are going to be covered by HIPAA as well, the privacy rule. So number three, to any healthcare provider who transmits health information in electronic form in connection with transactions for which the Secretary of HHS has adopted standards under HIPAA. So again, this is just a very broad way of saying any healthcare provider that the Secretary of Health and Human Services says should be covered by HIPAA will be covered by HIPAA. These transactions that they're talking about here are claims, benefit eligibility inquiries, referral authorization requests. A lot, pretty broadly, whatever your doctor would be communicating will typically be covered under HIPAA. So I just want to make sure that I note here, using electronic technology such as email does not mean that a healthcare provider is a covered entity. The transmission must be in connection with a standard transaction as defined by the Secretary. So it has to be something that the Secretary has identified as a covered activity. So, permitted uses and disclosures. This is something that a lot of people don't understand very broadly, so we want to take a little bit of time here. A covered entity is an entity permitted but not required to use or disclose protected health information without an individual's authorization. So in limited circumstances, a healthcare provider could release this information without your personal giving them the right to do so. So this could be to you for the treatment, payment, and healthcare operations, so case management, insurance functions, and arranging for medical reviews. They could give you an opportunity to agree or object. They could also give your insurer a right to agree or object to paying for a certain procedure. Incident to an otherwise permitted use or disclosure. Again, this is a very broad way of saying whatever the Secretary deems is covered. That's put in there so that as technology advances, as new treatments and new ways of communicating are developed and implemented, you will have the Secretary will have the option of including them in the rule as well. For public interest and benefit activities are things that include for CDC, the Center for Disease Control, to collect disease statistics and things along those lines. A limited data set for purposes of research, public health care operations. Those are things like clinical trials and communicating among other healthcare professionals. So myths and facts. Let's talk about some of the things that you may think are true about HIPAA, which may in fact not be true. So the first myth we're going to talk about, HIPAA allows a healthcare plan or doctor to share personal health information with an employer. The privacy rule specifically prohibits healthcare providers and plans from disclosing your personal health information to employers without your explicit written consent. That's a very important thing. We're going to talk about explicit written consent as we go through here. So you would have to give your doctor in writing permission to share your information with your employer. HIPAA permits the widespread use and sale of personal health information for marketing. The privacy rule prohibits providers, plans, and other covered entities from disclosing identifiable health information to a third party for any marketing purposes unless you have written authorization to do so. So you would have to give your insurance provider, your healthcare professional, your written permission to use your information before they could use it for any marketing purposes. Another one about HIPAA here in Title I. One doctor's office cannot send medical records of a patient to another doctor's office without your consent. That's not true. There's no consent required for one doctor's office to transfer a patient's medical records to another doctor's office as long as it is for treatment purposes. As long as you have sought out that other doctor or they're communicating with the other doctor for treatment purposes, so sharing the information so that the other one can give a consult on your case. A hospital is prohibited from sharing information with your family without your express consent. This one's a little bit tricky. So a healthcare provider may disclose to a family member or other relative or a close personal friend of yours or any other person identified by you in two scenarios here. So if the patient is present and conscious and able to give consent, the healthcare provider may disclose to such people if no objection is made by you. So if you're in the room and there are a bunch of people in the hospital room with you and the doctor comes in and you don't ask everyone to leave before the doctor gives you the information, the doctor may present the information to you with the other individuals present. If you are unable to agree or object to this disclosure, the provider may determine whether the disclosure is in the best interest of the patient. This one is where it gets a little bit tricky and why it's very important to have written guidelines for what you would like to be shared and what you would not like to be shared with your family, your friends, your close acquaintances. Because if not, it's left up to somebody else's discretion on whether to share that information or not. So a patient's family member can no longer pick up prescriptions for the patient. So a family member or other individual may act on your behalf to pick up filled prescriptions, medical supplies, x-rays, or other similar forms of protected health information. There is not a requirement for this to be in writing. The HIPAA privacy rule permits the healthcare provider, so in this case a pharmacy, to reasonably infer that doing so is in your best interest and in accordance with their professional judgment. So if they judge that this is a case where It's in the best interest of the individual. They can allow a family member to pick up your prescriptions or other protected health information. For more information on that one, because again, it is a very complicated thing. Some pharmacies will not allow a family member without written authorization to pick it up. It's a professional judgment issue. For more information, there's a link here that can give you that information. So one more here. The press can no longer access vital public information from hospitals about accident and crime victims. This one is pretty straightforward. HIPAA is allowing the hospitals to continue making public, including to the press, certain patient directory information, including your location in the facility, the condition in general terms. Typically opted out of having that information publicly available. The hospitals are responsible for telling you what information will be included in the directory and to whom that information will be given. And you have the option of expressly stating that you do not want the information to be released. And you can either say that orally, you can tell the doctor, you can tell the administrator that you don't want that information included in the directory or issued to anyone who contacted the hospital for comment. You can do that either orally or in writing. All right, so now that we've covered the HIPAA privacy rule and gone through how it's protecting your information broadly, that you have these general protections, we're going to cover the security rule on how that information is actually being protected. The security rule is mostly on how a health insurance provider or a doctor or physician is required to keep your information safe. So we're going to talk about covered entity, what information is protected, and the safeguards that go into protecting it. So a background on the security rule. It involves security safeguards that are protecting your EPHI. The security rule deals with the various security standards that each provider is going to follow to ensure the highest level of confidentiality of all of their EPHI, and that the provider creates, receives, and updates or sends. So any information that ends up in a provider, they have a responsibility of protecting as long as it is covered information. So they are expected to protect their entire electronic system from any threats to the security like computer bugs, viruses, or even indiscreet office personnel. So who is covered by the security rule? It's applying to health plans, healthcare clearinghouses, and to any healthcare provider, just the same as what the HIPAA privacy rule is covering. This covers the same people in the line there. They have to keep your information safe. So what information is protected? All of your EPHI, but it does not apply to protected health information transmitted orally or writing. It only applies to health information that is transferred electronically. So security rule safeguards. The security rule requires covered entities to implement 3 types of safeguards. They have to implement administrative, physical, and technical. So the administrative safeguards they have to take. These are the policies and procedures to manage the selection, development, implementation, and maintenance of the security measures used to protect your electronic or your EPHI, and to manage the conduct of the covered entities' workforce. So this not only covers all of the information sent electronically, but also making sure that an indiscreet office person doesn't reveal your information as well. So this is assigning a security responsibility, information access management, and security awareness and training. So training is the big one to deal with your workforce. Physical safeguards, so they have to have, again, policies and procedures to protect the electronic information systems. So they have to have facility access controls, for example, so that's limiting the physical access to your facilities while ensuring that authorized access is still allowed. Workstation and device security, so policies and procedures regarding the transfer, removal, disposal, and reuse of all of your electronic media. So if they get rid of a computer because it's too old and they replace it with a new one, they have to make sure that the protected information that was included in that previous computer is destroyed before it is sent to onto its next home. So then the technical safeguards, technology, and the policy and procedures for its use that protect electronic health information and control access to it. Examples of this are access controls, passwords on computers, making sure that it's employee only that can access certain records, person or entity authentication, again, password protection on computers, and then transmission security. So you implement a firewall, you have computer IT people making sure that you aren't getting hacked into and that the information is safe within your network. So the Department of Health and Human Services recently released some new rules concerning HIPAA privacy and security. This happened just this year in January of 2013. So Title I, there's some big changes here. I'm going to cover it very broadly. There's a lot of very specific changes that don't necessarily apply to you. They're more in how insurance providers and others are required to keep information. So the big change that we want to cover here, Title I of GINA now contains a new privacy protection for genetic information. So genetic information is health information. So there are prohibitions against group health plans, health insurance issuers, including HMOs, and issuers of Medicare supplemental policies from using or disclosing genetic information for underwriting purposes, except with regard to issuers of long-term insurance policies. So all health insurance issuers are required to protect information and are required to treat genetic information as your health information and cannot use it for determining how much they're going to charge you, except with regard to long-term care policies. So long-term care policies, they can use genetic information still to determine how much they're going to charge. So modified definitions, some other things that changed, again, revolving around genetic information. Genetic information now includes information about the genetic tests of an individual or the individual's family members, and about diseases or disorders manifested in an individual's family or the family member, so your family history. This was always assumed to be the case when you were dealing with GINA and the protections it offered. This is now codified in regulation. Genetic tests are tests that, and the definition for genetic tests has changed to include all genotypes, mutations, or chromosomal changes. And genetic services mean a genetic test, genetic counseling, and genetic information. So this is just broadened definitions that now include a lot more about what science has discovered recently and providing more protections for your genetic information under HIPAA and under GINA. This is another big change. Manifestation or manifested has been changed. An individual has been or could be reasonably diagnosed with a disease, disorder, or pathological condition by a healthcare professional with appropriate training and expertise in the field of medicine involved. So what this is saying is it's not manifested if the diagnosis is based principally on genetic information. So in the case of Huntington's disease, HD is not manifest just because you get a positive test for the gene. The presence of a genetic variant alone would not constitute a diagnosis, even in cases where it is certain the individual possessing that genetic variant will eventually develop the disease. And Huntington's disease is specifically mentioned here. The definition does not preclude a healthcare provider from performing a genetic test to confirm manifestation, so long as the diagnosis is not based solely or principally on the result of a genetic test. So that's just making sure that your doctor does his due diligence on manifestation and make sure that the symptoms are present, not just the gene. And then we are to our question. Jane, I'm going to turn it back over to you. Jane, are you there?
Hi, sorry about that. Questions will be answered as they're received. To ask your question, just hit send. So far, we're still waiting for questions to come in.
All right, great, Jane. Thanks so much. I'm just going to, I know that I apologize, I went a little fast there at some points. There's a lot of information to cover, and I want to make sure that we have an opportunity for you to ask questions. Just a brief caveat, with specific questions about specific situations, it's going to be very difficult for us to give you an example or an answer. So we may direct you to speak to a legal counsel in those cases. But other than that, please feel free to ask Chelsea and I some questions. We're happy to answer them.
I think we should have a few questions. Are you seeing them?
I am, Jane. They're coming up now. Give me 1 second here.
Great. Thank you so much.
Okay, so the first question I have here is, if my employer enforces a surcharge if you smoke, why is this not a violation? The violation, I'm assuming you're talking about HIPAA here. HIPAA is not covering specific activities that you're undertaking. It's preventing pre-existing conditions from being excluded based on a 6-month timetable, as we talked about before. I'm sorry, a 63-day time period, as we talked about before, and then the 6-month look-back period. So when it comes to smoking, smoking is an activity. It's not a pre-existing condition. Another thing to note about that, come January 1st, 2014, smoking is one of the conditions that the ACA specifically says an insurer can charge you more for that activity because it typically leads to higher charges for them. So smoking is not something that is covered under HIPAA. It's also not something that is going to be treated well under the ACA. Insurance premiums will typically be higher for those individuals that smoke than those who do not. I have another question here. Elaborate more on GINA and how it affects. We didn't want to cover too much on GINA because we've already done a pretty elaborate presentation on it with a lot of information that you can listen to and watch the webinar. And there's also a lot of information included on HDSA's website about GINA that you can peruse through it at your leisure. The web address there, again, is www.hdsa/GINA, G-I-N-A. So when you look at GINA, you're going to be able to find a lot of information there that is going to be relevant to you. And of course, our contact information is included. If you have any specific questions, we may be able to answer them, or we may direct you to talk to an attorney or a medical professional.
And I'll just interject for a minute. Also, if you look on the Department of Health and Human Services, or Office for Civil Rights, they have a great section about GINA that really goes into the different privacy rules that are going to take effect in GINA. So I would really suggest that you look to their website also.
And there's a link to that included. The next one, the last slide described a change regarding genetic testing. Is that the only change made in January 2013 relative to Huntington's, or just the most important one? That's a good question. It's the most important one. The other changes that we talked about, the change in the definition of manifested, and the change in some of the other things are definitely important as well. There are other more general provisions in the HIPAA changes that are important, but again, they don't necessarily affect you or the way you access healthcare. It's more on how long an insurance company has to keep information for a look-back period, things along those lines. Thanks for the question, though. Are there any other changes coming in January 2014 under Obamacare that we need to know about? Yes, there are a lot of changes under the ACA that are going to be important, not just to the HD community, but also to the entire community of people accessing health insurance. Without taking a stand on whether the ACA is a good thing or a bad thing, I think that there are parts that can apply to both categories. The ACA does have a lot of changes that are going to be relevant based on the fact that everyone in the country must get insurance coverage. And if they don't have health insurance coverage, there will be a penalty based on your income that is assessed at tax time. There will be subsidies that are involved that give you access to health insurance if you are low income, make it more affordable to purchase meaningful health coverage. There will be insurance exchanges set up in each state individually, or the national exchange that will be operated in roughly half of the states. That national exchange is going to provide subsidies as well, although they're still trying to work out the kinks in that and see how that's going to operate. The open enrollment period for the exchanges start at the end of this year, and I know that HDSA is working now on some resources and tools that you can look at on how the ACA would impact the HD community.
Thank you, Jason. So we do still have time for a few more questions. If anyone else has any other questions, please do send them to us. And just to echo what Jason said, HDSA is watching very closely as the provisions of the Affordable Care Act have gotten implemented and do get implemented, and we will be making sure that folks are informed about that.
All right, did we have any other questions that we could answer for you? All right, well, it sounds like everyone has a lot to look over here. There's a lot of information included in this presentation, and as Jane said at the beginning, it will be accessible on the HD website. You will have access to it. You can look through it. Again, please contact HDSA, and HDSA will get in touch with us. If you have any specific questions, we'll do our best to answer them or direct you to some resources where you might be able to find a more complete answer if you come up with some things later. Thank you so much for joining us. I hope you got something out of it. I know that it was definitely an informative thing going through and making sure that all this information was put in one place for you to access.
Thank you, Jason, and thank you, Chelsea, and thank you to everybody who joined us today. I hope that you also take the time to give us your feedback so that we know what topics to cover in the future. Thank you so much.